I'm Dr. Frankline Sevidzem Wirsiy, a global health expert and future leaguer from Cameroon. I'm at St. Louis University Institute of Health and Biomedical Sciences, Douala, Cameroon. I came to find out from some of my students and mentees what it means to be prepared for the future of healthcare in Cameroon.
My name is Biola. I'm a nursing student. For me, being prepared means that after my studies in the medical school, the healthcare system should be structured in a way that I'll be able to take care of as many patients as possible without the fear of who pays bills or not. Moreover, I should be able to provide effective, efficient, accessible, and equitable healthcare to all across the health continent.
My name is Kwete Patience. I'm a medical laboratory student. For me, preparedness means I should be ready to respond as a frontliner with adequate resources held in place in case of any disease outbreak.
My name is Munya Aibu Jr. I'm a young Cameroonian studying dentistry. For me, preparedness means that by the end of my studies, the government, through the Ministry of Public Health and its partners, make sure that universal health coverage is fully implemented, while making sure that the promise of health equity is achieved, such that people get quality health services at affordable costs, including dental services of quality, as in patient needs. Thank you.
My name is Karangon Ruben. I am a young Cameroonian studying pharmacy. Preparedness for me means receiving quality education, oriented towards a more public health aware market, such that the knowledge and skills which I acquire will enable me to make immediate contribution in the domain of health policy, including health financing, while advancing in my career in global health.
I am Wirsiy Jean-Claude, a young Cameroonian studying pharmacy. To me, preparedness means that the government should initiate, develop, and improve on medicine and vaccine production in-country, managed by well-trained personnel. This is going to save money for the government, and it's also going to make people to be aware that we are not just pharmacy salespeople, despite our great training in school. As a pharmacy student, I would like a future where people are not giving up on their health due to inaccessibility to medicine and how expensive drugs are. Thank you.
I'm called Emmanuel Tebo, a young Cameroonian student studying physiotherapy. Preparedness for me means that with regards to physiotherapy, the healthcare system in the future should be designed in a way that we move from a treatment and a rehabilitation approach to a preventive and well-being approach. Take for instance, in the case of ergonomics, I should be labeled as a physiotherapist to be able to act as a consultant to various companies, to various industries and offices to help them design their work environments in a way that they prevent injuries and increase their productivity of the workers while maintaining a good health status.
As a youth advocate, the effect that COVID-19 pandemic will have on our future healthcare systems is such that our healthcare delivery will allow for the adoption of new care models. Rising acuity, that's overall increase in chronic diseases and comorbidities as a result of the pandemic, virtual and digital health solutions will influence our health financing. Also, we'll need to understand our future clinical demands so that it orientates us in the workforce development and planning for health resources. Health is wealth because healthy people drive strong economies. If we are not prepared, we are going to fail. Preparedness for me lies in seeing Cameroon restructuring, redefining its health financing system so that we move more rapidly towards universal health coverage and sustain its gains. This is going to considerably reduce the out-of-pocket health expenditure, which stands at 73% in Cameroon, very high, and also will strengthen our national public health security. Furthermore, we will have to review where we are in terms of universal health coverage and how our health financing systems are functioning with these mechanisms. Our strategies and policies for healthcare financing are ideally through a multi-stakeholder perspective involving all key players like the Ministry of Finance, etc. We will have to monitor and evaluate the progress of these policies in place and make sure that they are moving. And lastly, we are going to try to achieve all the three goals of universal health coverage: quality of care, equity in the use of health services, and financial protection. It's not going to be easy, but together as a nation, we are going to make that happen. I am the future. We are the future. Together, let's light up the future.